No, is the answer to that. I mean, CBD has no psychoactive effects whatsoever. It can make you drowsy in large doses, but it certainly won't produce the high feeling that people associate with cannabis. That's THC. You know, it's scalable. If you have a lot of THC, you will get psychoactive effects. If you have a tiny amount of THC, you won't. And getting high is not part of the program. You know, it can be helpful in certain conditions and certain states, but really it's not. It's a distraction from what we're actually doing. These substances are working on a biological system, and you don't need to have any psychoactive effects for that to happen. It's almost, we don't want the psychoactive effects most of the time. It's sub-perception. They're doing their job when you take them. And that takes time. It's a slow process, and patients have to be involved in that process by making better choices about their own lifestyle. But the combination of those two things, that's where we bring back the natural homeostasis I keep talking about. Getting high is not part of it, really. I mean, sure, if there are times where it might benefit someone on a psychological, perhaps even spiritual level, if you want to look at it that way. But that's patient specific. But I would expect a large number of my patients to have no interest in getting high, no interest in psychoactive effects, and I wouldn't be dosing them in a way that would do that either. It's a distraction, and it's part of the problem, really. So once we can make people understand that these are effective, and it's not about getting stoned, it's not about getting the munchies. You know, these are not things that, these apply to a different world. You know, weed culture, you know, that's part of our society, and it's not going anywhere, but that's not what we're doing here. It's apples and pears. It's got nothing to do with us.